You must be bitten by a vampire if you want to look and feel young for the next 10 years. Is that what I'm really saying? Well, what I'm really saying is there's a brand of platelet-rich plasma, or PRP, you may have heard of this, that teaches doctors, and it's called the Vampire brand. So it's the Vampire Facelift, the Vampire Facial, there's the O shot, O, you know what that means? There's the P shot for men and their intimate function. And so I need everybody to know that the Vampire brand is legit, okay? And it's not really a vampire, but it does use your own blood. And we started to talk about this on our first posting yesterday. Today is our second post on YouTube. And thank you for the avalanche of people that have already subscribed, because we're gonna talk about great things. Well, I'm gonna talk about PRP and platelet-rich fibrin for the first month, because that is the foundation of regenerative medicine. Yes, the day is coming when we're going to lean into some of the high level things, the things that are going to support organ function. Yes, maybe even regrow organs. We try to be really responsible in the words that we use, but we do have early signal that regenerative medicine is going to do things that are going to blow the mind of current physicians who haven't been able to see yet on the clinical front lines what we've already seen in our practice as we developed technology over the last 10 years. So it started with PRP. So this is a time for me to give a shout out to the giants that came before me, because I used to not believe in these things. But, and this is my salute to Charles Runels, who invented the Vampire brand. Again, Dr. Runels taught us how we could do a simple blood draw to get this regenerative power that comes out of your own body. And we talked a little bit yesterday how we use that particular payload or technology from head to tail, from head to feet. And we've used it from the bottom to the feet to the top of the head for therapeutic indications, for aesthetic or lifestyle indications. It gives people a better life, okay? And so we're gonna lean into that a little bit more over these next weeks to come. But right now, I need to give a shout out to that person that came before us, and that is Dr. Charles Runels. So the way Dr. Runels envisioned this is when he had, as an innovator, the idea that we had this power within us to be able to do all kinds of things. He started ideating what types of things that could be. So he understood that because the signals that come out of your own blood draw have the ability to turn on stem cells and to be able to make scar tissue go away, to make nerves grow, to make blood vessels grow, that there were so many degenerative processes, things that take our years away, take our youth away, take our appearance away. And so Dr. Runels started teaching physicians how to use his Vampire brand. And we have found that to be remarkably effective for the right thing. Now remember, we are talking about real medicine right now. So any intervention that any doctor ever considers for a patient, whether it's a drug, whether it's a surgery, whether it's a lifestyle modification, these are all ideated to help patients, and there is a lot of nuance. Every single patient is different. Every patient responds differently to technology, and this technology, platelet-rich plasma, platelet-rich fibrin, or the plasma that comes out of your own blood, is a technology that every person, listen to me right now, should be taking advantage of every year for the rest of your life. So if it starts off right now that you don't have any issues with the intimacy part of your life, maybe you're not losing hair, maybe you love your skin and you love the structure of your face, maybe the only thing that we do is increase skin quality by putting in this payload that we draw out of your own body and literally microneedle it into your skin. I got a call from a patient this morning who said, Dr. Lawrence, and I was calling this patient for a completely different reason. I told her about this channel that we started yesterday, and she said, Dr. Lawrence, I gotta tell you, I had that one procedure last time with my own plasma, and my skin has been amazing. She said, I wish I would have taken before and after pictures. And we normally do take before and after pictures, but in a busy practice, sometimes we don't get them. So, but this was a patient just saying, I love my skin. So we're gonna, in the days, in the weeks to come, I'm gonna have a lot more conversation with you about why you need to be bit by the vampire. I'm Super Doc G. Put on your cape and fly.